I'm lending my support to this product for the first time in my 26-year career. And the reason I'm doing that is because I've seen the results and I've investigated the science, and I can't say that I've ever found a product on the market that can do for my patients what I've witnessed being done. Furthermore, I began taking the product, and I've always been a supporter of food being the best medicine for human health and recovery. I know that the cellular level is where we live and die, and it's the components inside the cell that has the greatest impact on and why it's so important. And it's all about function. And the fact that we live and die at the cellular level, and its free radical antioxidant fighting capabilities is what you're looking for. Now, from a clinical point of view, when I'm working on a person, when someone comes to me initially and is seeking help, my first objective is to stabilize their condition, to try to help them get out of the tailspin that they find themselves in. When you stabilize people, you're really trying to understand what system, not their symptom, but what system is the most involved. And I've had trouble with a couple of people over the years, and one in particular was a lady who I had done blood tests on. I adjusted her every way I knew how. We evaluated her diet and worked on her thyroid, numerous things. And it was really kind of mind-boggling to me, because I knew her personally and we were friends, and I kept watching her fingers become more and more swollen and more difficult for her to make a fist. And believe me, my heart went out to her. And then one time she came into me and she said, "Look at this," and she could make a fist. And I was like, "Oh my goodness, whatever you've done, I need to know about that." She said, "I'm just drinking this juice that my husband gave to me." And I said, "Well, whatever that juice is, I need to know what the juice is." So she told me about the juice, and I looked at it and I read it, and I said, "Oh my gosh, antioxidants, anti-inflammation." Well, there was nothing that we had done before that had addressed her antioxidant, her oxidative problem. And as a result of that, I started introducing this product to a lot of other people. Another lady was quite overweight, and she told me that she couldn't even walk through the malls because of the pain in her feet and her ankles and her knees. And within about a week of drinking them, she told me that she was with her father in the mall, and he said, "You better slow down." And she said, "I don't need to. Nothing hurts anymore." Now, before I get into whether or not this is the ideal pain relief potion, or if it should be taken for preventive measures, I want to talk to you just a little bit about some of the words you may have heard me talk about already, which are antioxidants and free radicals. They've been getting a lot of popular press, attention in the popular press over the years, and I want to explain to you briefly what they are. A free radical is a molecule inside the body, and it basically was stable, meaning it had an electron on either side of it. And the best analogy I can use to describe this would be a picture of Mickey Mouse, where you have the face of Mickey Mouse and you have an ear on either side. If I showed you a picture of Mickey Mouse without an ear, you would say, "Well, that looks a little odd. That looks a little radical." Well, that's what a free radical looks like. Doesn't have the balancing electron on either side. Now, when you have these free radicals that are scavenging around looking for another electron to balance them out so Mickey looks like Mickey again, the process that goes through is oxidation. And we're trying to put antioxidants back in the body to give Mickey back his ears. In the process of looking for that radical, a lot of damage occurs in the body, and that's what causes aging. And believe me, the list of conditions from Alzheimer's to migraines to Parkinson's and all sorts of chronic degenerative diseases are attributed to free radical damage inside the cell, particularly the mitochondria, or the little powerhouses inside the cell. So the best way to get this is in the form of fruits and vegetables. They have the most concentration, the greatest concentration of these antioxidants. Now, I know that as much as people know about the importance of good nutrition, that they're not going to go out and eat the recommended amount of fruits and vegetables every day. As enthusiastic as I am about nutrition, I know that I don't. And I think I'm far and away above the rest of America in my dietary discipline. So again, 2 ounces in the morning, 2 ounces at night has the antioxidant equivalent of eating 13 servings of fruits and vegetables. Now, that's a lot of fruits and vegetables. I know that I'm not going to go to the store and buy 13 servings of fruits and vegetables every day, cut them up, cook them, juice them, whatever I'm going to do to them. So I hate to say this, but this is an extremely convenient delivery system. I just pour 2 ounces of the juice, tastes like grape juice, in a little shot glass every night and every morning. It's great. So really, whether you're a person who's looking to have renewed health because you have an ache or a pain that hasn't gone away, or you're a person that realizes the benefits of long-term good health. But let's say you watched your mother, your father, your husband, or your wife, or someone you know that's near and dear to you, and you've seen them go through the ravages of cancer, as I have in my family, or kidney disease, or chronic heart disease, arterial disease. It's everywhere. And I don't want that for myself, so that's why I